Good morning, my junior doctors. Today we will be studying Chapter 52 of Parikh's Textbook of Medical Jurisprudence, Forensics Medicine, and Toxicology. The chapter is in regards to fuel, and I will be using this book as a guide. Under fuels, we will be studying petroleum, which is also known as rock oil. As we all know, petroleum consists of two constituents, gas and liquid. It is an oily liquid found under the ground in several parts of the earth. When petroleum is refined, it is known as kerosene. During the process of purification, there are other products which are separated. They are classified into two groups on the basis of their boiling point in comparison to kerosene. The products which are lighter than kerosene, that is, they have a lower boiling point, are known as gasoline. They include ether, pentane, hexane, octane, petrol, naphtha, benzene, etc. The other group, which is heavier than kerosene, that is, it has a higher boiling point, are known as lubricating oils. Vaseline and paraffin. In general, among all of the petroleum distillates, their toxicity is indirectly proportional to their boiling point. An inverse relationship means that the lower the boiling point, the higher the toxicity, and the greater the boiling point, the lower the toxicity. With this relationship, we can state that the gasoline part of the distillates are more toxic than the heavier, higher boiling point lubricating oils. That is why we can safely use Vaseline in different cosmetic products on our skin, and different mineral oils are used in a lot of different products. But these gasoline distillates are very poisonous when swallowed or inhaled. Petroleum distillates are irritants is because of the following reasons. They dissolve fat cells. They depress CNS cells. We can remember this as the double D. They dissolve and they depress. Now we will discuss kerosene poisoning. Specifically, the signs and symptoms of kerosene poisoning. If any patient ingests the lighter distillates, these will be the signs which will be found. The very first sign will be a burning sensation in the throat. The typical signs of nausea, vomiting, and diarrhea, colicky pain, also the breath, vomit, and urine of the patient will smell like kerosene, which is a very obvious sign. Another symptom is the effects on the respiratory system. There will be lung complications like pulmonary edema and bronchopneumonia. Cyanosis can develop. And the central nervous depression, which we talked about here, depression of the CNS cells, will cause giddiness, weakness, and drowsiness, followed by coma and death from respiratory failure. If the patient inhales fumes, then the symptoms will be slightly different. They will have a headache, vertigo, nausea and vomiting, but no diarrhea, and also lung complications, which we talked about earlier. The different symptoms of inhalation will include intense excitement, hallucinations, and convulsions. A way to remember this is by the acronym HEC: hallucinations, excitement, and convulsions. In fatal cases, cyanosis, unconsciousness, and coma precede death. In a patient with chronic poisoning, the symptoms will be slightly different. It is known to happen in persons who handle petroleum products. The principal symptoms are anemia, and from anemia, we can result the other symptoms, which will be weakness, weight loss, dizziness, peripheral numbness, paresthesia, a very easy way to remember all these symptoms is by remembering the anemia. Since most of us already know what anemia is, deficiency of blood in a human body, we also know that anemia causes these symptoms in a patient. So for chronic poisoning, remember that it will cause anemia, and from there, we can easily list the other symptoms. The treatment of chronic poisoning requires the patient to be isolated from the environment which is causing the kerosene exposure, and then symptomatic management. Next, we will talk about the fatal dose. The minimum amount of dose of kerosene which is needed in order to cause death in a person is more than 10 ml of kerosene. A tip I use to remember this amount is the term 10K race. A 10K race is a race of 10 kilometers. So 10 is the unit of 10 ml, and K stands for kerosene. I hope that will be helpful. As for the fatal period, that means the amount of time after the ingested fatal dose to cause death in the patient is a few hours, nothing specific. And this is because of the intense pulmonary irritation that petroleum products cause. Next, we will talk about treatment for kerosene poisoning. If ingested, what we will do is wash the stomach with warm water containing 5% sodium bicarbonate. The absorption of the petroleum products can also be slowed down by giving 250 ml of liquid paraffin orally, followed by a saline cathartic. These are the three things you have to remember: a stomach wash with 5% sodium bicarbonate, 250 milliliters of liquid paraffin orally, and a saline cathartic. If the poison has been inhaled, the patient must be removed from the environment to the open air, and artificial respiration is persisted in. The rest of the treatment is symptomatic. Next, we will talk about the postmortem appearance. There are a few points that we will list in order to help you identify if the dead body died because of kerosene poisoning. The first point is there will be acute gastroenteritis. We can link this with the stomach wash, which is used as a treatment. You can link these in order to remember the postmortem appearance. The second is a kerosene smell, which is a very obvious symptom, from the stomach and the lungs. Got it? Also, like we talked about over here, when we talked about the symptoms in any patient who inhales or ingests kerosene, there will be bronchopneumonia and pulmonary edema. So similarly, in the postmortem appearance, we may find pulmonary edema and bronchopneumonia. Degenerative changes in the liver and kidneys and hypoplasia of the bone marrow occur after prolonged period of inhalation. So degenerative changes of the liver and the kidneys plus hypoplasia of the bone marrow. These are slight unique symptoms, so you'll have to memorize them. Other signs of asphyxia may also be seen because, like we discussed, kerosene poisoning has an effect on the respiratory system. During the post-mortem analysis, if the death is due to petroleum, both the lungs and the brain have to be preserved for chemical analysis in saturated saline. Saturated saline. Next, we will talk about the medical legal aspects. As most of us already know, in a lot of Indian and Pakistani dramas, we have seen different actors emotionally blackmail their family and friends by threatening to burn themselves with mitti ka tel. That is called self-immolation, and usually kerosene is used for it. Homicidal attempts by pouring kerosene on the clothes and igniting them are also common cases of different deaths in the subcontinent. However, most fatalities are accidental, like if a child drinks kerosene mistakenly thinking it's a glass of water, or during. Also, I've sometimes heard of people trying to suck petrol from car tanks through a rubber tubing. That can also cause isolated cases of petroleum poisoning. That was all for today. I hope you've understood the clinical implications of kerosene and poisoning. If there are any other topics you'd like me